So today's special topic will be insomnia, and I believe everyone encounter this problem before. Like you find it very hard to sleep, you feel tired when you wake up, and you don't know why and how to help yourself in this situation. So today I would like to share some information about this insomnia to you to let you know better about this insomnia, and also how what you can do to help yourself with this problem. So what is insomnia? It's actually a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. Which means that maybe at night you find it very hard to sleep, or maybe you sleep halfway and then you wake up, or you wake up too early in the morning and then you find yourself cannot sleep back. So all these symptoms is known as insomnia, means you have problem with your sleeping. And you may still feel tired when you wake up. So usually people with insomnia, they will feel restless and very tired the next day. They feel like they don't have enough sleep. And this situation set not only your energy level and mood, but also your health, work performance, and quality of life. So normally with insomnia, you will feel that your energy level is very low, like you're very tired, you don't have energy to do anything, and your mood is like so-so, means that you are not happy, you're not excited. It will affect your mood because you don't have enough of sleep. Maybe you feel irritated or stressed. And for long term, it will also affect your health, your work performance, means that you cannot perform your work normally. Maybe you find it very hard to complete some of your jobs, your tasks of the day, and also your quality of life. So there are actually two types of insomnia. So I've listed here. The first one is known as a short-term or acute insomnia. So for this type of insomnia, it usually only lasts for days or weeks, and it usually results from stress or traumatic events. Stress, I believe, is the most common factor of insomnia for all of us. Like you have stress from work, from anything, it will usually cause you very hard to fall asleep at night. Or even traumatic events. Traumatic events include like maybe your family members getting sick, or like someone just passed away that give you a shock. Then you may also encounter this insomnia. Maybe you keep thinking about that thing so that you find it very hard to sleep at night also. The second type of insomnia is a long-term or chronic insomnia. So usually this type of insomnia lasts for a month or more. And usually with this long-term insomnia is encourage you to go and see a doctor to help you to determine the cause, and maybe to help to give you some medications to help with your sleep. Because for long-term insomnia, if you don't do anything, it will like slowly affect your health and also your life and your work performance as well. So what are the causes of insomnia? We have 6 main causes here. The first one is stress. So like I mentioned just now, maybe you are stressed about work, like your health, finances, your family. Usually this kind of stress can keep your mind active at night. So you will keep thinking about these things, and it will make you difficult to sleep. Or even like traumatic events like I mentioned just now, such as death or illness of your loved one, you're having a divorce, or you lose your job, or you have some financial problems. These will also lead to insomnia as well. The second is a travel or work schedule. So our body actually, we have a rhythm called as the circadian rhythm. This kind of rhythm is like your body clock, which means that you sometimes find yourself wake up automatically without alarm, maybe at a certain time. Like every day, maybe you wake up at 9 a.m. Even on weekends, you're not working, you also wake up at 9 a.m. And then you'll find yourself sleepy maybe around 10 p.m. or 11 p.m. So this one is your body clock. So your body will follow this time schedule to let you to be awake and sleep. So if you have a good circadian rhythm or body clock, usually you will not have the problem of insomnia. But let's say you have a travel or work schedule that is not fixed. So sometimes your this body clock will be disrupt, and this will lead to insomnia. So like for travel, maybe you travel to a different country, like European or Western country, where the time zone is different from our country, Malaysia. So normally, our nighttime is their daytime, our daytime is their nighttime. So this will cause a shifting in the travel schedule and your body clock. So usually when you travel to that kind of country, you'll find yourself very hard to fall asleep following their time. Okay, or even you working late, like maybe you work overseas and it's different time zone as Malaysia also, it will also disrupt your body clock as well. So this will cause insomnia. Okay. The third one is poor sleep habits. So these poor sleep habits include irregular bedtime schedules, naps, stimulating activities before bed. Maybe you do some vigorous exercise before bed, or an uncomfortable sleep environment, using your bed for work, eating, or watching TV. Because sometimes if you use your bed to do something else, your body will not recognize your bed as a sleeping place. So sometimes even you lay yourself on the bed, you find yourself very hard to fall asleep because your mind already said that, oh, this place sometimes you use for work, sometimes you use to eat, sometimes you use to watch TV. So it's very hard for your body to determine what you want to do in your room. Okay. So sometimes these kind of habits will lead to insomnia. So the fourth one is mental health disorder. So this one is a more serious cause of insomnia. It usually includes anxiety, post-traumatic stress disorder, which is PTSD. This kind of disorder will also disrupt your sleep. Okay, so maybe you feel like you are very nervous sometimes, like your heart beating very fast, you very anxious. This kind of mental issues will also cause you to fall asleep very hard. So you may have insomnia. The fifth one is medication. So sometimes some of the prescription drugs can affect your sleep, like certain antidepressants or medications for asthma or blood pressure. So sometimes even in the pharmacy, you buy some pain medication, allergy, cold medication, weight loss product that contain some specific ingredients. They may also disrupt your sleep. So sometimes when you take in this medication, you will face insomnia. The last one is caffeine, nicotine, and alcohol. So caffeine is normally what we can find in coffee. So we know coffee is to help us to keep us awake because it has these ingredients called as caffeine that will stimulate your brain to work, to function, to keep you awake. So if you drink coffee in the late afternoon or evening, some people they will find it very hard to fall asleep at night because this caffeine will accumulate in your body for some time before they are being excreted out. So if you drink coffee or tea in the afternoon, maybe this is one of the cause of your insomnia, that you find it very hard to fall asleep at night. Even for tobacco, the cigarette, nicotine also will help you to stimulate your brain. So if you smoke or even you drink alcohol, sometimes it may affect your sleeping quality and cause you to have insomnia as well. So these 6 are the main causes of insomnia. So if you have insomnia, what are the symptoms that you can see? So the first one is difficulty falling asleep at night or waking up at night. So like this is one of the very common symptoms, that you find yourself very hard to fall asleep, or even you sleep but you find yourself waking up at night and then very hard to fall asleep and then waking up again. Okay, so this is one of the main symptoms of insomnia. The second one is not feeling well rested after a night's sleep. Like I mentioned just now, also insomnia people, they might feel very tired the next day because they don't have a good sleep. They feel like they don't rest enough. Okay. The third one is daytime tiredness or sleepiness. So if you didn't sleep well, normally we'll feel very tired the next day, or even we feel sleepy the next day. So these kind of symptoms also may may tell you that you have insomnia. Okay. The fourth one is irritability, depression, or anxiety. So like just now, I also mentioned that long-term insomnia will affect your mood as well. So if you have insomnia problem, it may cause you to be irritated easily, like maybe you get angry very easily about something, or you might have a depression or anxiety. The fifth one is difficulties in paying attention or focusing on tasks or remembering. So this one is like a longer term of insomnia that already affect your brain function. So sometimes you do something like your job or your housework, sometimes you find it very hard to pay attention or focus on their task, or even remembering something. Maybe you realize you keep forgetting about something that you should do or you should bring. This kind of symptom also will tell you that you maybe have insomnia. The last one is increased errors or accidents. So for example, like when you're doing your task, your job, you find it you make errors easily, like you do something wrong easily. So this one also is one of the symptoms of insomnia, because it already affected your brain function. So for the symptoms, it actually has a lot more, but I just briefly describe the 6 main symptoms of insomnia here. Okay. So who will get insomnia easily? Like these are the risk factors. Of course, everybody can get insomnia, but some people, they might get insomnia easily compared to a normal people. So these are some of the factors that will put you into higher risk of getting insomnia. The first one is 60 years old or more. So if you are 60 years old and above, you might need to take care, because changes in sleep patterns and health, insomnia will increase as we age. So as the older you get, the higher risk that you can develop insomnia. The second risk factor is women. So women, we have all the hormones, we have our menstrual cycle. So during this hormonal shift, like our hormones keep changing, or even you're already having your menopause, it will actually affect your sleeping quality as well. So you might feel that you are very hard to fall asleep as well lah. The third one is, like I mentioned, have a mental health disorder or physical health condition. So this kind of condition may affect your sleep as well, because if you are sick or you have some mental health disorder, it makes you very hard to like relax and not to think about anything. So sometimes you find it very hard to fall asleep at night. The fourth one is under a lot of stress. So like for people who is very stressful, or like some working adults that they encounter a lot of stress in their family or their job, will actually lead them to higher risk of this insomnia. Okay. And the last one is do not have a regular schedule. So like if you're working, like your shifts keep changing. Sometimes you work in the day, sometimes you work in the night, or like traveling, like I mentioned, to a different country can also disrupt your sleeping cycle. So if you have these factors, they may put you into higher risk of having insomnia. So for the current treatments of insomnia is very easy. The first one is cognitive behavioral therapy. So it's like a therapy for your mind to relax. So what they do is they actually help you to avoid, like advise you to avoid naps during the afternoon. So because sometimes people nap in the afternoon, then they will find it themselves very hard to fall asleep at night. So this therapy sometimes they will encourage you to not take afternoon naps. So you wake up in the morning, you resist taking naps in the afternoon, then you feel tired, so you will sleep easily at night. Okay. Some people in this therapy, they will ask you to have a relaxation techniques. So like they ask your muscle to relax, they teach you some breathing exercise to help you to reduce your stress, to let your body relax. So when your body is relaxed, your heart rate is low, this will set your body into the sleeping mode. So it will actually help you to fall asleep easily lah. Or some during this therapy, some people they also use light therapy, which means that you can actually use light to control your internal clock. So our body actually recognize light, like if you've got sunlight, then it will recognize it as daytime, so you should be awake. But if you have no light, then you should fall asleep. So actually they will use this light as a stimulus for your body to help you to adjust your body clock again. Okay. So usually they will combine different therapy in this cognitive behavioral therapy to help you to adjust your lifestyle and behavior, to help you to develop good sleep habits to help you to sleep well. The second treatment is medication. So this one is like the medication that we always see in the drama or like in the pharmacy, the sleeping pills that can help you to get to sleep or stay asleep lah. But this medication actually is not good for long-term treatment. Okay, so you still have to go back to your doctor to ask them whether you are suitable to use it or not. Okay. The third one is changing or adjusting your lifestyle habit. So this one is more for like short-term insomnia. So for the lifestyle habits, you can slowly adjust. Like maybe you set yourself like I have to wake up every day 8 in the morning and then sleep during 11 at the night. So you will adjust your body clock accordingly to let your body to familiarize with this schedule, so you will not find yourself very hard to fall asleep at night. Or even changing your lifestyle habits, like cut down on alcohol, on smoking, on the caffeine, the coffee, or like stop exercising during nighttime. Maybe you can exercise during the daytime. Adjusting these small lifestyle habits that your body will slowly recognize your body clock schedule, so it will help you to sleep better at night also. So for the treatments, there are currently these 3 treatments lah. But here actually we have one treatment which is known as reducing electron treatment. Is actually the root treatment for insomnia. So for further information on this, I will share on the later session. But just a brief introduction to you that we have this treatment known as reducing electron treatment that can actually help people with insomnia, to help you to improve your sleep quality, to help you to improve your body condition from the fundamental, which is your cells. So it is known as the root treatment for insomnia. Like for sleeping pills and any medications that you can get from the doctors of the pharmacy, they usually help you to sleep immediately, like on the spot when you take, and then you can go to sleep. But the next day, maybe you will encounter the same problem again, like you still find that you cannot sleep at night, so you need to take again the sleeping pill. So you will keep on depending on the sleeping pill for long term. But for this reducing electron treatment, it will help you to improve your body from your cells, begin with your cells. So like in long term, it will help you to improve insomnia in your body without relying on any medications lah. So for long term usage, you can slowly improve your insomnia problem with this treatment. So for the further details, I will share later on the next sharing session. So as we know, sleep is very important. So no matter what kind of disease, stress, anything that you have, actually sleep is the best treatment, because during sleep, if we have a good sleep, our body will be able to recover faster. Like now, even you getting like a booster vaccine, sometimes you find yourself very tired, like your body just want to sleep, because your body need the time, the time when you sleep to help you to repair your body. So when you have a good sleep, after the sleep, normally you'll find yourself feeling refreshed, energized. So this is why sleep is the best treatment for anything. Okay. So this introduction about insomnia is until here. So if you have any question, you can just unmute or type in the chat box. And if you want to know more about this reducing electron, you can contact the number below or even go to our website to read more materials on it. So any questions so far? Okay, if don't have any question, I will continue to the next session, which I will share the research done by Dr. Nobu Horiguchi about insomnia and reducing electron. So like I mentioned just now, reducing electron treatment is actually the root treatment for insomnia. So maybe you'll wonder why I say so. So now I will share some of the research done by Dr. Nobu Horiguchi, which is the founder of Reducing Electron, to help you to understand more on how actually this reducing electron can help us with this insomnia. So why do we need to sleep? Why do we need a deep sleep? And why does doctor give sleeping pills after surgery? Okay, so as we know, like I mentioned just now, sleep is very important. It's actually the best treatment for us. Okay. According to research, subconscious mind is the one helping us to repair our body. So we need to sleep to activate our subconscious mind to help us to repair our body when we are sleeping. However, if you are awake, your subconscious mind will not be able to repair your body because your subconscious mind only works when you are in a deep sleep. So even you are sleeping, but you are sleeping like lightly, your subconscious mind will not work also. So that's why we need a deep sleep and a good sleep in order to activate our subconscious mind to help us to repair our body. So usually you have a deep sleep. The next day, normally you'll feel very energetic, refreshed, because your body is already repaired by your own subconscious mind. Our body actually has its own recovery power, and it only functions when we are in deep sleep. Like I said just now, we need a deep sleep, not a light sleep. So if you have a deep sleep, your body will be able to recover itself because it already has its own recovery power. But if you have light sleep, your body will not be able to recover itself because it is not activated. Okay, so you have to make sure that when you're sleeping, you're in a deep sleep. Then that is the best sleep that you can get to help your body to recover faster. So how do we get deep sleep? Since deep sleep is very important, okay. So the fastest way is to get sleeping pills. So sleeping pills is a normal remedy when you go visit to a doctor. So normally when you go to a doctor, you tell them, oh, you cannot sleep. Some doctor, they will give you these sleeping pills to help you to fall asleep. Okay. But like I mentioned just now, although sleeping pills can see immediate effect, but it actually has a lot of side effect also. For example, like brain function will be disrupted and weakened because these sleeping pills will actually affect your brain to ask your brain to shut down and go to sleep immediately. So if like long-term usage, it will actually affect your brain function. So you'll find that your working performance is not that good. Maybe you feel still tired even though you sleep already. Okay. The second side effect is long-term dependence on it. Like I mentioned just now also, even though like for the first night you take sleeping pills, you feel you can sleep immediately. But second day, if you don't want to take it, then you cannot sleep again. So it become your body rely on these sleeping pills, only it can sleep. Without these sleeping pills, it cannot sleep again. So this one is actually a bad long-term dependence on these sleeping pills. The last side effect is the liver and kidney will be affected due to accumulated of toxins. Not only sleeping pills, any medication, if you take long term, it will actually slowly affect your liver and kidney, because these two organs are the important organs that help us to excrete all the waste of these medication that we take. So if we keep taking sleeping pills or any of the medication, our liver and kidney will overwork, will be overloaded. So in long term, it will be slowly affected due to this accumulated toxin and waste in our body caused by this medication. So even though sleeping pills can see immediate effect, but as you can see here, it brings us a lot of side effect. So it's the best that if we can reduce the usage of sleeping pills, we don't rely on these sleeping pills to help us to fall asleep. So what can we do? Okay. So Japan has actually discovered the factors that cause us not to sleep well. For example, like I mentioned, lifestyle habits, like exercising at night, drinking coffee, or even stress, emotions, and a lot more These kind of factors will actually cause us not to sleep well at night. And these factors will also deplete our body's reducing electrons, and it will become a continuous cycle. Because if you have all this stress, bad emotions, the bad habits in your life, it will slowly reduce your body reducing electron. And normally people, they don't know about this reducing electron. They will not replenish their body with reducing electron. So they will keep losing it, and then it will become a continuous cycle. Like you losing your body reducing electron, your insomnia will get back again. So it will become a continuous and a bad cycle. So in long term, this will cause health problems such as low immunity, inflammation, and autonomic imbalance. Okay, so if you don't get enough of sleep, you find that sometimes you're very easy to fall sick, because your immunity also will be affected already. Your body does not have the power to repair itself, so you can get sick easily, or you will have inflammation and autonomic imbalance. Okay, so for these three characteristic is actually very important, because you can see here it's actually related to our self-defense. So self-defense is actually the power of your body to help you to fight disease. If you have a very strong self-defense, it means that you will not get sick easily. But if your self-defense is low or affected, then you might get sick easily. So like I mentioned just now the immunity, inflammation is related to this self-defense. So for the first characteristic of self-defense is actually cellular metabolism. So if our cells can carry out metabolism actively, then it's very good for our body, because it provides energy for our body to work and to help us to excrete all the toxin and waste out of our body. So if our cellular metabolism is affected, then all the toxins will be accumulated in our body. It will not be excreted, and the nutrients that we absorb will not be converted into energy. So slowly your body will be affected and you might get sick. Okay. The second is the strength of immunity. So like I mentioned, if you do not get enough of sleep, your immunity will be affected as well. So immunity is very important to help us to fight diseases. Once your immunity become low, then your body will get sick easily. The last one is inflammation. So just now I also mentioned insomnia will cause inflammation in long term. So for inflammation, actually is it will put you into higher risk of developing diseases. So if we need to ensure that this inflammation is at the lowest level possible to help us to maintain a healthy body. So if you have these three elements at a very good level, normal level, then your self-defense is strong. But like people with insomnia, normally their immunity and inflammation will be affected. So once these elements are affected, then their self-defense will be low as well. which is why if you do not sleep well for long term, slowly you will have different kind of diseases lah, like cardiovascular, kidney, maybe you have high blood pressure also. All these diseases will come slowly to you just because you cannot sleep well. So it's very important to make sure that you have a good sleep to let your body able to repair itself and prevent disease lah. So like I said just now, sleeping pills only help you to treat symptoms of insomnia. It will help you to sleep immediately, but only for that time being. It won't help you to long term to adjust your body to let your body able to sleep normally by itself. Okay. So Dr. Noboru Horiguchi, which is the founder of this reducing electron treatment, has discovered the way to treat the root of it, which is to replenish reducing electron of our body. Because if we have enough of reducing electron in our body, it can help you to eliminate all the, it will help you to lower your stress, eliminate all the toxins in your body. So for long term, it will actually slowly help you to improve your sleep quality. Let your body can adjust itself back to a normal schedule, which you can fall asleep by your own. You don't need to rely on any medications to sleep. Okay, your body will have the power to get you to sleep easily at night lah. Okay. So this is the basic elements of human body. So normally what we know is we need water, oxygen, nutrients, protein, carbohydrate, vitamin, fat, and others. But what we overlook normally is reducing electron. So this one is a research done by WHO. They actually found that human body needs 13 billion of this reducing electron per day to be healthy. So like I mentioned just now, for insomnia people, normally they have stress, or like their emotions are not good, not stable. Their lifestyle habit also, these kind of factors just now I also mentioned will deplete all your reducing electron. It will use up your reducing electron. So if you do not replenish this reducing electron, slowly it will affect your sleep quality, and then will cause you to have a lot of diseases as well. So our human body actually needs 13 billion of this reducing electron to be healthy. So if you make sure every day your body has this amount of reducing electron, then it will help you to improve all your problems. Okay, it will help you to reduce your stress, remove all the toxin, and then improve your sleep quality as well. Okay. So what reducing electron treatment can do, it actually has a lot of benefits. So I will just share some of these briefly. The first one is to increase blood circulation, purify blood, restore body liquid back to weak alkaline. So our cells actually live in the water of our body. So we have to make sure that the home of our cells are always clean and nice for them to live in, so they can be healthy. So reducing electron can make sure that our body fluid, which is our blood, always at the weak alkaline pH, which is suitable for ourselves to survive, so that our cells can be healthy. The second is it can help us to neutralize harmful acidic substances in the body, like I mentioned, to help us to remove the waste also. The third one is regulate autonomic nerve system, balance blood pressure, and relieve stress. So this one is also very important for insomnia people, which is to help them to relieve stress, regulate their nerve system, and also balance their blood pressure. Because some of the insomnia people in long term, they will find that their blood pressure also will be affected. So reducing electron treatment can actually help in such way. The fourth one is to repair cells, activate cells, scavenge harmful waste and toxins in the body. So like I mentioned also, it will help you to remove all the waste, help your cell to repair, to be healthy. The fifth one is regulate and balance the electron in the body to create a clean internal environment for the cells to live on. So by regulating and balancing the electron in our body, our cells will have a good environment which is suitable for them to survive and to be healthy. The sixth one is enhance resistance and immunity. So like I said, insomnia people, they usually have low immunity because they cannot sleep well. So reducing electron treatment can help them to enhance their immunity, to strengthen the immunity back. And the second one is also the seventh is also related to immune system, which is to strengthen the immune system, like I mentioned, and immune cells such as NK cells, T cells, and B cells. So if we have a strong immune system, then we will be able to fight diseases. The A1 is to reduce bad cholesterol. This one is also a very good function because it will help you to prevent the cardiovascular diseases and also the arteriosclerosis. The 9 is regulates endocrine system and balancing hormone level. Okay, so like I've said, the risk factor just now, women will actually have a higher risk of developing insomnia because we have a lot of hormones, our menstrual cycle, and also menopause. So reducing electron treatment can actually help us to balance our hormones. Then it will help us to improve our sleep also lah. The 10 is to, as an antioxidant, facilitate the removal of free radicals, lactic acid, inhibiting oxidation and achieve anti-aging. So for free radicals, it actually will damage our cell if we do not remove them from our body. So reducing electron treatment can help us to remove these free radicals. So it will help us to protect our cells also, to help them to maintain in a healthy state. 11 is to activate the metabolism. So like I mentioned just now, during the triangle, the self-defense, one of the elements is cellular metabolism. So reducing electron treatment can target this metabolism, help us to activate our metabolism. Okay. The last one is to improve the absorption of nutrients into cell. So like I mentioned, it's also related to metabolism. Our cells need to absorb the nutrients to convert energy for our body to use. So reducing electron treatment can actually help us to improve the absorption of nutrients, and then will activate the metabolism, let our cells to convert them into energy and excrete the waste. So these are some of the main function of reducing electron treatment. So it actually targets a lot of different systems in our body to help us to achieve a healthy body. It also targets a lot of factors for insomnia, like just now I said, stress, the hormone problem, and also blood circulation. All these factors that will cause insomnia, it will target. So actually, reducing electron treatment has a very broad function in helping insomnia. So actually, human body consists of 70% of water. So like I mentioned just now, our cells live in this water. So in order for our cells to be healthy and able to survive, we have to make sure that our 70% of water is always in a weak alkaline pH. And what can help us to achieve this is reducing electron treatment to help us to maintain our 70% of our water in weak alkaline pH to let our cells to be healthy and survive. Okay, so when our cells are healthy, our body will be healthy as well. Then it will help us to fight diseases. We will not get sick easily also. So these are some of the clinical studies that are done in Japan regarding how reducing electron treatment help with stress and also insomnia. So the first one is this brain wave. Actually, we have two brain wave in our brain. It's known as alpha wave and beta wave. Okay, so alpha wave appears when we are relaxed, in a relaxed state. So if you have a high alpha wave, means that your body is very relaxed, so you can sleep well. But if you have a very high beta wave, means that you are very nervous, very anxious, and this is why you cannot sleep well. So for achieving a good sleep, you need to make sure that your alpha wave is high and then your beta wave is low. So you can see here, the left side is alpha wave, the right side is beta wave. So the red one, the red bar is the group, the patients that use reducing electron treatment. The blue one is without reducing electron treatment. So you can see for alpha wave, we want it to be high. It means that our body is relaxed. So before treatment, you can see the red bar is at 30 something percent, 34% around. And after treatment, it increases to 63 63.6 average. Okay, so you can see it actually increased a lot for the alpha wave, which means that reducing electron treatment can help us to relax our body. So for beta wave, you see the red bar. Before treatment is 33.7%, and then after treatment is 18. So it actually helps us to decrease the beta wave, which help us to become not so nervous, in decrease the feeling of nervous in our body. So from this study, we can actually see that reducing electron treatment can help us to relax and decrease our nervous or anxious to help us to not get nervous. So if we are very relaxed, we are able to sleep well. Okay, so it shows that reducing electron treatment help us to relax our nervous system. The second clinical studies is about the blood beta endorphin. So endorphin is actually a chemical that will be produced when you feel happy. Okay, so it's a happy hormone. When you're happy, your body is relaxed, which means that you can sleep well. Okay, so for this study, you can see that the red bar is also the group that undergoing the reducing electron treatment. So before treatment, you can see that it's 7.66, but after treatment is 8 point something average. So reducing electron treatment actually help us to increase this happy hormone in your body, okay? Which means that it helps you to relax your nervous system, make you happy, so that you can sleep well at night. Okay. The last one is blood cortisol. So this one is related to stress. Cortisol hormone is one of the hormone that will release when you have you're under a lot of stress. So what we want is our cortisol level to be lower, so that we will not feel so stressed. We are able to sleep easily at night lah. So for the red bar also is the one that undergo reducing electron treatment. So you can see before treatment the cortisol level is around 7, but after treatment it goes down until 4.82, which is a lot. So it shows that reducing electron treatment actually reduces our stress. So you can see from the 3 studies, it helps us to relax our nervous system, increase our happy hormone to help us to feel relaxed, and at the same time also reduce our stress. So it actually helps us to feel relaxed, that your body to be able to sleep easily and not feel so stressed. So reducing electron treatment actually do a lot of things to help us to achieve a healthy body, and also to help us to sleep well at night lah. Okay. So as a summary, reducing electron treatment is to strengthen the self-recovery of living body and increase body natural healing power to overcome the disease. So like I mentioned just now, is different from medication because it helps you to strengthen your self-recovery. Your body has its own power to recover. Like I mentioned just now, your body can recover itself during deep sleep. So reducing electron treatment is to help you to achieve a good sleep, a good deep sleep, to help you to use your own recovery power, to help you to repair your own body, and also to increase your body natural healing power to help you to fight diseases. So this is why reducing electron treatment is very helpful, not only to insomnia people, also to a lot of diseases and also healthy person. Everyone need reducing electron to help their body to become healthy. So the sharing about the research done by Dr. Norbert Horviji is until here. So if you have any question, you can ask now.